Today I'd like to talk to you a bit about measuring your customer or patient loyalty. One of the most important ways to grow a business is to focus on the customer. To measure customer loyalty in a quantitative manner, Fred Reichheld introduced a unique metric called Net Promoter Score in his 2003 Harvard Business Review article, One Number You Need to Grow. To determine this number or score for your practice, you simply need to ask your customers a single question. On a scale of 0 to 10, how likely are you to recommend us to a friend or colleague? The respondents that give you a score of 9 or 10 are called promoters. Patients who give you a score of 7 or 8 are called passives. And any who give you a score of 6 or below are called detractors. Your final NPS score is then calculated by deducting the percentage of detractors from the percentage of promoters. A positive score means you have more promoters than detractors. A positive score is good. It means your business should be growing. An NPS score of 50% is generally considered to be excellent. The Net Promoter Score metric is gaining popularity among businesses that aim to maintain a real pulse on what their customers actually think about them and improving the metric. A growing number of organizations, including GE, Philips, Apple, American Express, Rackspace, and Intuit, are adopting the Net Promoter System as a way to assess and improve their degree of customer loyalty and satisfaction. There is a clear link between the growth of the NPS and the revenue growth of an organization. The second part of NPS involves asking the respondent to explain their score. This is very powerful for two reasons. First, you gain the information that tells you what you can do to fix a problem. This is especially important if the respondent is a detractor. Now you have actionable information and may begin fixing issues right away. It's also important to remember that if a patient is telling you they are angry or dissatisfied, the information should be forwarded to the person who runs your office so they may take steps to fix the problem immediately. This is why all NPS forms are emailed to you, the doctor, and the person who runs your office. And second, you know where you stand with each patient. Promoters must be taken care of. They are telling you what matters to them. So make sure they get those things over and over again. Make a note on that patient record so that everyone knows how to treat them in order to maintain their promoter status. Also keep in mind that promoters are the patients from whom you can ask a favor. Need a video testimonial? Ask a promoter. Need before and after photos? Ask a promoter. Need someone to write a review? Ask a promoter. Remember to talk about these issues during your team meetings. First, decide if the issue is something you want to solve. If it is, think through how to solve it permanently. Assign responsibilities and hold people accountable by checking on progress during subsequent team meetings. Please keep in mind that no business, including your practice, can satisfy every customer. There will always be approximately 5% of your customers who will never be happy regardless of what you do or how hard you try. They are not the right fit for you or your practice. For example, let's say Mrs. Jones is used to a doctor she can spend 30 minutes or more with during each visit. She needs this time factor in order to feel satisfied. Let's assume for a moment that this isn't the focus of your practice. You, as the leader, must make the tough call to tell Mrs. Jones that you feel your practice philosophy is not a good fit for her.